If you're healthy and self-employed, stick around. Private health plan alternatives to Obamacare are covered later in this video.
Okay, so today I'm going to try to make a quick video to explain to you exactly what Obamacare ACA Marketplace is, who it's for, and you can then decide if you want to start looking at private health coverage for your particular situation. We'll talk about what it costs, and another big question that people have is deductibles and whether it's an HMO or PPO. So, what Obamacare is, we're going to cover the prices. Different areas of the country have different premiums. Particularly in the Northeast, the premiums are much higher. Deductibles are also vary based on your area, and out-of-pocket is pretty standard. And then we'll talk about the HMOs and the PPOs. So, who is it for? It's for people who don't have health coverage through work. They're not on Medicare. They don't have VA coverage. They're not on Medicaid. They have no coverage. And typically, at least with my clients, it tends to be self-employed people, realtors, people who make a high income but don't get coverage from work. Those are the people that I deal with most of the time. But it also includes everybody else who maybe are on a lower income that can't get Medicaid. They also use Obamacare a lot. So what makes it good? What makes it different? The big thing is there's no pre-existing conditions. If you have a health condition that requires a lot of care, you're not going to get a private health plan because they underwrite them, unless you're in a group of 5 or more where they waive the health questions. But if you're just a single, you own a business, you got 1 or 2 people working for you, you are not going to get a subsidy. But if you have pre-existing conditions, you really have no other choice. They all have essential benefits, all the Obamacare plans, meaning your doctor visits, blood work, things like that, getting mammograms, colon checks. Those are all covered, usually without a deductible. That's what's known by essential benefits. Subsidies. This is big. If you get an income subsidy, a lot of times the premium is next to nothing. Very inexpensive, so they make sense in a lot of different situations. And they have different tiers, which I'm going to cover pretty good here. Bronze, silver, there's gold and platinum plans too, but mostly when I talk to people, they either have a bronze or a silver plan. Premiums vary throughout the country. Depends where you live. Your age affects it. The networks available in your area determine whether there's going to be a lot of HMOs or PPO. And it also depends on how many insurance companies are in the marketplace that you're in. If there's 1 or 2 or 7 or 8 different insurance companies vying for the business. So typically, the bigger cities have more options than the rural areas. And the subsidies, of course, they play the biggest part of who's going to be on ACA or Obamacare. Nationally, the price for the plans averages out to $625 on a silver plan. However, in the Northeast, we have plans that are, in Vermont, they're $1,200 a month. And this is for a 40-year-old, a single 40-year-old. Obviously, if it's a family plan, up in the Northeast, it can be close to $3,000 for a family plan. But nationally, for a 40-year-old, it's $625. California can be a little higher, but nobody is as high as the Northeast. New York, Massachusetts, Connecticut, Vermont. That's where the premium is the highest and where people are most affected. Just to give you some examples of states, Vermont, $1,299 a month, to Indiana, which is $474 a month. So that's a pretty big spread. So it does matter where you live. Deductibles. Now, this is where people have to be aware. If you are on a silver plan now, 2026, the deductible is national average is $5,300. Again, in other areas, it's a little higher. But what does that mean? That means whatever your premium is, you can add another $400 some a month because you can't use the coverage until you reach the deductible. So this is why, at the end of 2025, a lot of people dropped their silver plans and went to the bronze plans. But the deductible national average on a bronze plan is $7,500. Up in the Northeast, it's usually around $9,200 for a deductible. So figure that out. Divide 9,200 by 12, and you can pretty much add that to your premium because you're not using the coverage till you hit the deductible. Max out of pocket, this is pretty standard across the country, $10,600 per person. That means after you reach your deductible, your max out of pocket is $10,600. Once you go out of pocket, $10,600, then the plan covers everything. And for a family plan, it's capped at 21.2, which is basically 2 max out of pockets, regardless how many people are on the plan. Now, another thing to keep aware of, on the bronze plan, after you reach the deductible, you pay 60%, the insurance company pays 40%. On a silver plan, the plan pays 60%, you pay 40%. On silver, it's 70-30. They pay 70, you pay 30. And again, you can get bronze and gold. Gold is 80-20. Most people don't look at those options because the premium's pretty high. Network, this is another big thing, especially nowadays. We're getting a lot of calls from people who are saying that the only affordable plans in their area are HMOs. If your doctor and all the facilities in your area accept the plan, then the HMO is fine. But if they don't, they're not fine, because if you cannot go outside of an HMO. You have to be within somebody or some facility that's within their network. A PPO is different. That's what most people want. They do have their own networks where you get lower co-pays and deductibles, but you still have the option of going out of network if you want. Maybe you want to go to a specialist somewhere in a different state, or PPO gives you the option for that. You don't have that option with an HMO. So when you're looking at your plan, you want to look at what the premium is and the deductible. My little trick is I take the premium, I take the deductible, divide it by 12 and add that to the premium. That's effectively what you're paying a month before you can start using your coverage. The max out of pocket, pretty much $10,200 per person. And the other key thing is you want to look at is my doctors and all the facilities in my area in network. Again, that comes back to the HMO PPO thing. So the reason I made this video is to explain to people exactly what the ACA is, who it's good for, and who should be looking at other options if they're healthy. First of all, if you're low income, ACA is fine. You can even look at going up to a gold or a platinum plan because the subsidies are so high based on income, you don't pay that much when you have a subsidy. The other, if you have pre-existing conditions, you're treating for cancer, you have liver disease, you're getting kidney dialysis, you have no choice. You have to go with an ACA plan. because you can't get private coverage. So at my company, Clear Choice Health Insurance, take my glasses off now that I'm not reading, we do a health review for all of our clients. Now, I will say most of the people who come to us are self-employed or they're high earners that don't get coverage from their work. A lot of realtors, even insurance agents, financial planners, definitely a lot of small business people. Now, if you're healthy, now this is for groups of less than 5. So if you're a one-man show or a one-girl show and you just need coverage for you and your family, you're going to have to answer the health questions. And what they're looking for is people who are already in the process of claiming on something. If you have a group of 5 or more, you can apply for private health coverage as a group in which there are no health questions. So that's important. The savings for private health insurance is just, it's huge right now, especially since they took the subsidies away. Deductibles, they're not $5,000, $9,000. You can get deductibles as low as $500. A lot of people do $1,000, even $2,000, but much less than the deductibles of any of the ACA Obamacare plans. They're almost all PPOs, meaning you can go to any doctor, any hospital in the country. They all have, I'm talking about private plans now, they all have prescription health coverage. Most of them have telehealth, where there's no copays, no deductibles. So if you're not feeling well, you can get a hold of telehealth and do your appointment there. And the savings is, like I said, huge. Dealt with clients who were paying $2,500, $2,800 a month for a family plan, and we were able to get them into a solid PPO private health plan for less than half of that. Single people, depending on where you live in the country, people in the Northeast were saving as much as 50% for lower deductible, PPO coverage, major medical coverage. So you have to be proactive today. If you're healthy and you're paying a full unsubsidized premium for health insurance, that's on you, because it's very easy to reach out to somebody who's in this business like myself. They'll do a full review on you, find out what your health is like. Once we know that, we can show you what options you have. And the savings are usually tremendous. So, again, I am with Clear Choice Health Insurance. I own the company, been in business for over 30 years. If you reach out to us, our information is in the description. We will do a quick review on what coverage you have. We'll go through your health situation and explain your options. There's never any obligation to do business with us. Also, spend some time on this channel, subscribe. I put out videos regularly. And we talk about different things like the different private health plans that are available, health shares, which is a whole nother subject, but there's a lot of information on the channel about that too. So thanks for watching.